Have you ever clipped on a fingertip pulse oximeter and watched the numbers jump around? 98, 96, 97, back to 95. Does that mean the device is broken or inaccurate? Not necessarily. In this video, you'll learn how to use a fingertip pulse oximeter correctly, what SpO2 and pulse rate actually mean, what counts as a normal reading, and the 7 key factors that affect accuracy. And if you're a medical device buyer, distributor, or private label brand, will also walk you through exactly what to check when testing OEM samples. Stick around for that part. Let's start with the basics, the correct way to use a fingertip pulse oximeter. Before you measure, sit down and relax for a moment. Keep your breathing calm and natural. Check your finger. It should be warm, clean, and dry. If your hand feels cold, gently rub your fingers together or warm your hands first. Cold fingers are one of the most common reasons people get unstable readings. Now open the clip and insert your fingertip fully into the device. Your nail should face upward, toward the display. Don't insert just the tip. And don't put your finger in at an angle. Once your finger is in, keep your hand still. The device needs a few seconds to detect your signal. You'll see 2 main numbers appear, SpO2 and pulse rate. Don't record the reading the moment it shows up. Wait until the numbers settle and stabilize. That's it for the basic steps. Simple, but a lot of people skip 1 or 2 of these and then wonder why their readings don't look right. Now let's talk about what those 2 numbers actually mean. SpO2 stands for peripheral oxygen saturation. In plain English, it's an estimate of the percentage of oxygen being carried in your blood. For most healthy adults at rest, SpO2 commonly reads between 95 and 100%. Pulse rate, sometimes shown as PR or BPM, is how many times your heart beats per minute. For many healthy adults at rest, that's roughly 60 to 100 beats per minute. But normal ranges can vary based on age, fitness level, medications, and overall health. A pulse oximeter is a useful tool for home monitoring, but it's not a diagnostic device on its own. If you're seeing unusual readings, or if you feel unwell, shortness of breath, dizziness, chest discomfort, please consult a healthcare professional. Now, here's the part most people don't know: 7 factors that can directly affect how accurate your pulse oximeter reading is. Factor 1. Cold fingers or poor circulation. A pulse oximeter uses light to read signals through your fingertip. If your finger is cold, or your circulation is poor, that signal gets weak and unstable. Warm up your hands before testing. Factor 2. Movement during measurement. This is the #1 reason people get inconsistent readings. Any movement, tapping, shifting, even slight shaking can throw off the signal. Keep your hand completely still until the reading stabilizes. Factor 3. Incorrect finger position. Or if it's sitting at an angle inside the clip, the sensor won't get a clean read. Make sure your fingertip sits flush against the sensor. Nail facing up. Factor 4. Nail polish or artificial nails. Dark nail polish or thick artificial nails can block the light transmission the sensor depends on. For the most accurate result, use a finger without dark polish. A light or clear polish is usually fine. Factor 5. Strong ambient light. Pulse oximeters are optical devices. Bright sunlight or intense overhead lighting can interfere with the sensor, especially on lower quality devices with poor light shielding. Test indoors under normal lighting when you can. Factor 6. Low battery. A weak battery means inconsistent power to the sensor, which can lead to unstable or inaccurate readings. If your device is behaving strangely, check the battery first. It's an easy fix that people often overlook. Factor 7. Device quality and sensor stability. Not all pulse oximeters perform the same. Sensor quality, algorithm stability, the precision of the assembly, and the factory's quality control process all affect how reliably a device reads, especially across different users and conditions. This factor is especially important if you're sourcing pulse oximeters for distribution or private label. We'll come back to exactly what to test when you're evaluating OEM samples. That's coming up shortly. So how do you know if your device is actually working the way it should? First, measure 2 or 3 times under the same conditions and check whether the readings are reasonably consistent. Some minor variation is normal, but large swings are a sign something's off. Second, try a different finger and compare. Results should be in a similar range. Third, make sure your hand is warm and still during each test. Fourth, check the battery. Replace it if it's running low. Fifth, keep the sensor window clean. Dust or residue on the sensor can interfere with readings over time. If readings stay unusual after all of this, or if you have any physical symptoms, don't rely on the device alone. See a healthcare professional. Here's a quick look at what's actually happening inside the device. A pulse oximeter shines 2 wavelengths of light red and infrared through your fingertip. On the other side, a photodetector measures how much light passes through. Oxygenated and deoxygenated blood absorb these 2 wavelengths of light differently. The device uses that difference to estimate your SpO2 level. It also detects the tiny rhythmic changes in blood volume that happen with each heartbeat. That's how it calculates your pulse rate. This is why everything we covered, finger temperature, movement, position, ambient light, nail polish, battery level, and sensor quality can all affect what the device reads. If you're a medical device buyer, distributor, or private label brand, evaluating a pulse oximeter sample is a completely different exercise from just using one at home. You're not checking one reading. You're assessing consistency, stability, usability, and the supplier's ability to maintain quality at scale. Here's what to look at when testing OEM samples. 1. Test multiple units. Not just one. Batch consistency matters more than a single good sample. 2. Repeat the measurement several times on each unit under the same conditions. Look for stability, not just a good first reading. 3. Check the display. Is it clear and easy to read at different angles? Is the waveform smooth? 4. Evaluate the finger clip. Is the spring tension comfortable? Does it fit different finger sizes? 5. Review the packaging, user manual, and labeling. Are they clear, professional, and market-ready? Can they be customized? 6. Ask the supplier about their QC process, batch testing standards, and what documentation is available for your target market. A reliable OEM partner doesn't just send you a good sample, they show you how they maintain that standard across every production run. At YimiLife, we specialize in home medical and health monitoring devices, including fingertip pulse oximeters, blood pressure monitors, and OEM and ODM solutions for global markets. We support private label customization, packaging design, sample testing, and quality control for distributors, healthcare brands, and medical product companies worldwide. If you're evaluating suppliers, tell us your target market and estimated monthly volume, and we'll arrange a free sample and send you a quotation within 48 hours. Links are in the description below. Thanks for watching. If this video was useful, subscribe for more home medical device guides and OEM sourcing tips. We'll see you in the next one.